welcome to the Idea Gen Future of Global Summit live in Washington, D.C. It is an incredible honor and privilege to be here with you today with three living legends. It's an incredible honor because we're powered today by the American Psychiatric Association Foundation and the executive directors here with us, Mr. Rawle Andrews Jr. Rawle, welcome.
Thank you, George. It's a privilege to be here, and it's a privilege for the APA Foundation to provide support for the future of what we like to say hope, help, and heal.
That's right. And you're working on an initiative called mentalhealthcareworks.org. Got to plug that. It's an important initiative at an important time, at a critical moment. Why is it so critical?
So the Mental Health Care Works campaign is our campaign for humanity. And one of the things we're trying to do is to help globally all citizens to begin to prioritize their mental health in many of the same ways that we prioritize our physical health. So if I had stubbed my toe on the way into Idea Gen and needed urgent care, people would have rushed to me to provide help and some support. If I had come in out of sorts and not quite feeling myself, we don't necessarily have the same reaction, and I may not have the same reaction to say, oh goodness, I stubbed my toe. Or, I'm really in pain. I have invisible injuries that need help. And people tend to shy away from that. And after all we've been through, not only over the last 4 years, but certainly since we've come out of the pandemic, we have to get better about being whole and well.
That's right. We also have with us Ms. Kate Garvey from the city of Alexandria, Virginia. Welcome, Kate.
Thanks so much. I'm so glad to be here, especially with this esteemed group.
That's right. That's
I think
right.
you can rush for 1,000 yards.
She says it all the time. Right. You can rush for 1,000 yards or more, and that's an MVP on by any standard. And next to me, you know what I'm about to say, Colonel.
Don't do that.
An actual living legend, honored by the city of Alexandria as one of its living legends, Colonel James Paige. Colonel, welcome.
Good to be with you again, George.
It's incredible, again, to be sitting next to these three leaders. And, you open up the dictionary and you look at what is leadership. And the three of you exemplify that leadership. You embody leadership and you're leading your organizations in ways that it starts at the top. I believe that firmly. It starts at the top and it sets the tone. Sure, we're all servant leaders, but you set the tone. And for that, Idea Gen, myself, and this entire global community watching this, the millions of people that will watch this program will say that's leadership. Mr. Andrews, sir, would you just take a moment? I know there's a lot to unpack, but just to briefly describe your previous experiences and background and how those experiences and background have influenced your current focus, what you just talked about, what you just alluded to, which is the importance of mental health advocacy and the outreach being done as we're looking over Washington literally right now, the outreach being done to Washington and across the planet.
George, thank you for that question. I like to believe that I'm an advocate, and it really doesn't matter what the subject matter. So if I go back 40 plus years when I was student body president, I was an advocate for the students. One of my big initiatives at that time was just to get decent cafeteria food for my classmates. And while that seems lighthearted and probably not a problem that even has been solved in the 21st century, if we don't give sustenance to our students, they're not going to be ready to learn. That means they won't grow into the leaders we need them to be. When I got to college, I was the Chief Justice of the Student Court, a different kind of leadership, but it sort of paved the way for chapter one of my career, where I was in the private practice of law for 16 years. Again, an advocate, primarily representing industry. After 16 years in the private practice of law, I moved into chapter two of my career, and that took me into nonprofit administration, where I was working with AARP for another 15 years. Again, always advocacy, but my constituency was different because I was talking about the needs of older Americans and their family caregivers. But what happened during the pandemic? And I think we have to pause here, George, to think about where we were in May of 2020. We're talking about pre-vaccine COVID, wondering if I was going to live for 2 weeks if I contracted this dreaded disease. 4 years later, while we have some toxicity and we have some issues to work around our mental well-being, the reality of it is we're back to talking about the price of milk, bread, and cheese. While too high, it's still better than talking about whether or not if I'm in contact with virus, I'm going to die. So I think we're seeing our way out, but I started to see a swirl. It was an economic swirl, there was a public health swirl, and there was a social justice swirl. And we can't just act like 4 years ago didn't happen, right? So in order to get better to ourselves, being whole and well, that actually moved me into chapter 3 of my career, which was to come to the American Psychiatric Association Foundation and to basically turn our mighty but small entity into an engine of social change. And that is really what we've tried to do, to normalize the conversations, to lean into the technology advances and some of the destruction around technology that is causing some of the churn as well. But really to be able to help the whole house, because I wasn't able to do that in my chapter 2. And now I spend as much time with middle school and high school students and college students as I do their parents, their grandparents, and their great-grandparents.
Before you go
Please.
to Kate, can I say something about Kate? And this is an opportunity to acknowledge something. Back in 20, when COVID came, Kate, I never said anything to you about it, but you were such a blessing to our city. You were such a blessing. You convened us weekly with Jackie Tucker, and we got through this together. So to the world, I just want to say thank you for being who you are.
Thank you so much.
Appreciate
Thank
you.
you. And check is in the mail.
Well-
I appreciate that so much.
No Greek money.
And
though.
but I have to say, but you played such a key role, and so many organizations across Alexandria just came together because it was such a shocking and terrible time.
It was.
And our community and Alexandria came together in such remarkable ways, and people were so focused on how do we take care of each other, and how do we work together without turf, without credit. We need to do something differently. And it was a remarkable time. So I appreciate you. You were such a phenomenal partner and leader in that also.
I appreciate your comments too, but I don't want to take away from Kate, but one of the things that we did do though was to work better together.
Right.
And that was because of technology and leadership, and you were such a stalwart.
Thank you. So much.
Back to you, sir.
Well, and the idea here is that, and this came out in previous conversations related to this summit, it's that there are institutions. There's the city, there's the organizations, there's the people. The people are what we're talking about here.
Mhm.
People are behind the institutions. People are behind the countries. People run all of the operations around every entity that we view as that abstract entity. But without the people, if the people decide to go home,
Yeah.
there's no entity, there's no government. So motivating the people, leading, helping to understand in a crisis, it takes someone to say, hey, here's what's happening. That's what you did, Kate. That's what you're describing, Colonel, is you brought people together, people that represented other people and their organizations. So I think that gets lost as I look out on Washington. It always strikes me that, sure, there are institutions and they're incredible, but there are people, and those people are driven by, like you said, Rawle, the social media. There's so many messages. Gosh, I grew up at a time when there were 3 news programs at night.
Yeah.
And you got 3 messages and you maybe watched just one, and life was kind of simple. Now you can get lost on any, you name it, LinkedIn, go through the scroll and read anyone's opinion. Oh, and by the way, you can live in a world where everyone just agrees with you on whatever issue you want. If you think the New England Patriots are the best team in the history of the NFL.
Let's not do that.
So-
We know better.
So I won't go there. We don't want. We don't want.
Y'all are Steeler fans.
Okay.
Get over
Okay.
it.
We definitely won't talk about the Steelers. It's not that moment. Although I did like Franco Harris. We'll leave it there. Okay. Colonel Paige, first of all, thank you for your service. From the bottom of our hearts here at DGen, your commitment to our nation is profound. And I want to thank you personally and professionally. In your words, do you think your service, how does that military service guided your approach to community-based mental health initiatives today?
I could go on and on, but I guess I can just make it a personal story in my family. My daughter's here with me today. And, I remember her going through the issues of postpartum, the depression with her child. And I'm thinking, wow, there's help for my daughter and my family out there. So every time I see an opportunity to connect my family with help, I do it. So that drives me to Kate and to Rawle, who have a common interest among us all about mental health. It's a tough issue. In my community, it's an embarrassing issue. So my 30 plus years in the military gave me a chance to see life differently and different, and be non-pejorative about people. So when I see a young soldier in Korea, foxhole, and he's struggling, I have a personal connection to that soldier and to his family. So I've kind of done the chapter 2 thing like my friend Rawle did. Okay, I'm out of the service and I'm living in a good city working with good colleagues. How can I take my experiences and make it become a tool for the city? And I think we do a pretty good job. I think when I work with Kate, we look at issues like the 988 and crisis response and working with the sheriff and making sure that every child down on Backward Road knows that they can come to Kate's office for help. So I've changed my life based on my experiences in the military. I had a good career. I got out and I said, I'm just going to cool. I'm not going to do anything except watch the Steelers win the Super Bowl. Well, that went out the window. So then I got lucky and I met Kate and I met Rawle. And it really, those interchanges changed my life and let me build on what I'm doing. But before I answer the last part of your question, I think if you understood Kate's portfolio, you can appreciate my appreciation for her. Kate, please, your portfolio.
Thank you so much for that opportunity. So our Department of Community and Human Services is a unified integrated department. So we're really fortunate that we really have all services except for physical health within. So from early childhood to older adults, behavioral health services, all the benefits programs. And we serve about 40,000 residents in Alexandria. We have a staff of about 700 folks. And we have tremendous partners. So it isn't just the work that we're doing day to day. There's such a strong network of organizations throughout the city that we're having an impact on. And so we are fortunate too. We've just recently moved to a unified location, really trying to be, a whole place for whole people and whole families, rather than saying we have programs, we look at a slice of you of what your problem is. We're really saying, what are you trying to accomplish? What are you trying to solve? And how can we be partners with you in that? And here are all the resources for you to access. And quite frankly, an area we're trying to push more fully is, how do you design our services? Tell us what you want this to be. It shouldn't be saying we think this is the best for you. It's together. We're saying, here's what evidence is, here's what good practice is, and how do you want this to be for you and your family? And how do we make these resources yours? And so we are really fortunate, again, to be in a community like we are, where there is this openness, but also trying to really look at the scars that exist in our city, the history that we've had, and how do we really look at the trauma and heal together, and look at us as one whole community. So that's in a nutshell, that's what we're trying to accomplish.
And that's so powerful. For those of you, for our global audience, the backdrop of Idea Gen Global is always the 17 global goals of the United Nations. And Rawle, you're committed, your organization's committed, and all three organizations are committed to these goals for the simple reason that they were unanimously agreed to by all 193 member states, including Greece, the United States, and every other country that's a member of the United Nations. So there's unanimity. It may be, and is likely, the only time in the history of the United Nations where every single member state agreed to these 17 global goals. Kate, you touched upon partnerships for the goals. This is what this is. This is helping to achieve the global goals. Partnerships for the goals, goal number 17. Good health and well-being, another one of the goals. Rawle and the organization, the American Psychiatric Association Foundation, the APA as well, they're leading on this issue. both nationally and globally with the lessons learned. With everything that you're doing, you're changing the game. Again, the plug mentalhealthcareworks.org, because that's what this is. The other thing is cross-sector collaboration. All three of your organizations, you talk so much, Kate, about partnerships. Rawle, you always talk about partnerships. Colonel, you always talk about partnerships. These partnerships, you can't do it alone. We talked about the importance of people. People and partnerships. People are behind those partnerships. Because the three of you leading your organizations believe inherently in the power of partnerships, that's why you're able to change the world. And by the way, we're almost already at 2030. Who knew that in 2015, as we're looking at these global goals leading into 20, it would happen like that? It's 2024. We're past the halfway point. We have a lot of work to do to get to 2030. Everything from eradicating poverty, hunger, good health and well-being. There's so many issues globally. And there's a lot of incredible work being done right now by all of you, which is helping us to get there. Let me ask the three of you this question. Whoever would like to answer it, totally fine. What do you all see as some of the primary mental health concerns, both at the local to the global level? We're talking local to global. This is a local community where the lessons learned can apply globally. What are you learning? What have you seen? And beyond today, how are your organizations actually addressing these issues?
According to the World Health Organization, 1 in every 10 persons on the planet suffers from depression. That's diagnosed. Undiagnosed, we know the number is higher. When it comes to the United States, nearly 20% of all Americans are suffering from some mental health condition that ranges from anxiety to depression to even serious mental illnesses like bipolar or schizophrenia. And then when it comes to our students, 44% of our K-12 students are in a persistent state of despair and hopelessness. That's over 2 out of every 5 students in the United States, with almost 20% of those students that actually have either contemplated suicide or actually have a written suicide plan. These are students who have already lost hope before they even really begin to live life. And I would say quickly that because we talk about whole health and the goals, George, let's think about hearts and minds, because cardiovascular disease and the mental antecedents around cardiovascular disease, heart disease still is the #1 killer. But think about what kind of baggage you're carrying around in your mind. If you know you're struggling with heart disease, or don't know you're struggling, but you just don't feel yourself. So we got to do something collectively around heart disease and mental well-being.
Good.
Yeah, I would just add to that, the substance use disorder is really very serious. And again, in all ages, and the access to substances and the degree to which people are self-medicating, dealing with, with what all the trauma, all the stressors that they are dealing with, and having such much broader access, particularly our youth at this point. And so I absolutely agree with everything that you're talking about. The one bright light for me is in younger people having a greater acceptance to talk about mental health issues and to potentially access services. And I feel like in that regard, they are more open than we were, and to say this exists. Now, do we have mental health services and behavioral health services that are reflective of the youth who are coming to work with us? Do we have services that are culturally competent? That's what's important. When they are willing to come, do we have the approaches that are effective with them, that really address their issues, that really are looking at the trauma that is really driving a lot of this? So I think it is extremely serious. I think there's potential for us to be able to pivot and to do more, but we've got to really take this very seriously every single day, recognizing how pervasive it is. Yeah.
Kate and I talk often about her challenge of the different populations in our city. I think the #1 challenge right now is immigration from Afghanistan.
That's the largest population.
The largest population coming in. So balancing that, the city council and spending money, because from my opinion, mental health drives homelessness and all along the road. So it makes Alexandria an expensive place to live. It does. So an appreciation for a global impact of mental health and what it means to the city is a conversation that we need to continue to have. But one thing I would like to share for both of them is that the heart of our city, the gateway of our city is our schools. It's ACPS, and the relationship with Dr. Wyatt and her staff has to be good. And Rawle came over and spent some quality time with Dr. Wyatt and talked about the GA. And I know of your relationship with her. I'll finish my comments with this. In my organization, CCNA, we do three things. We look at the equity issues for health, education, and social justice. And we put everything under that. And we talk often about how do they intersect. So a smart kid goes to school, he eats well, comes home and has a good environment and has access to the internet, and he's not harassed by the cops. Those things become the foundation for the next generation. So my personal plea is that we continue to look at those issues as they relate to each other. They're not exclusive, they're inclusive of each other.
So powerful. I'd like to shift a bit to ask you all, this is all fantastic. However, there are challenges. There are many challenges for your individual organizations and collectively. What are the toughest challenges that you're facing right now?
Hanging out with Rawle is better.
There are always issues related to having enough resources, and we are facing serious issues related to attracting and retaining staff, and that's across the nation. So really, particularly in the mental health area and social work area. So that's something that's really important to us. Having staff feel supported and being able to do the work is foundational for our approaches. But in terms of our community, affordable housing is a critical need, and it has such an impact on everything else. And again, we're fortunate in that our city is committed to increasing affordable housing and partnering with others to do that, but it's still a big challenge. I think the other piece too is really economic stability and mobility for us. We really do have sort of two communities within the city.
Really?
Can you verify?
Yeah.
And so how that's driven, by systemic racism and other things that have long-term history in our city and how we're trying to overcome those things, but really focusing on how can someone build well, first get stable, actually have enough to live and eat and really support the family, but then also to build wealth and to feel as if they have a place within the community. Again, I do think it's a place where this can happen because of the commitment, because of the people working together on it, but it's a critical area, and the level of instability really that was so illuminated during COVID, is still continues. Food insecurity, affordable housing, and other areas there. So only one or two issues for us, just small ones.
Was that exacerbated by the pandemic?
Absolutely,
Yeah.
Absolutely, and really particular people who have working so hard, working 3 jobs, doing the best that they can to keep their family housed, and then the loss of employment, the loss of access to food. So it was really it was so clear what was really happening that many people didn't see, didn't know about, and there too, again, just to talk about Alexandria, that people did respond as they became more and more aware of what people were suffering, their neighbors were suffering. Yeah.
George, if I might add, also, as that's happening, our kids are getting further and further behind in school because they're not in school, and that continues to affect our city.
The business of America is still business. And so workforce is probably the number one challenge, but workforce extends to the pipeline, and it talks to the pieces around education that Jim has already discussed, as well as some of the other social determinants like housing and food, which Kate has discussed. But, one of the things that we do is we run a pipeline program for medical students as well as residents in training to be psychiatrists. And so here they've gone through either coming to medical school or they've been to medical school, and then they have 8 to 10 years in front of them to actually be trained. The challenge is we're not growing enough of the next generation of mental health leaders and professionals fast enough for the rising need. And I think one of the things and Kate knows this better than I do, but one of the things you see is that before the pandemic, when you talk about exacerbating, the problems were already there. The problems pre-existed COVID, but people had to come out of the shadows to survive. And then when they came out of the shadows, they found out their cities were bare.
Right.
Their towns were empty. People didn't want to work in an office anymore. But people had signed these 99-year leases for these big towers. What do you do when nobody wants to come downtown and there is no downtown? And I do believe we got a long way to go before we work that out. But what I'm asking, and I think it's fortunate, we just had our APA annual meeting convention in New York City, and our new president is from New York, but he's a South Asian immigrant from India. And Dr. Ramaswamy Viswanathan basically has as his presidential theme for the next 12 months, lifestyle medicine. And that will include lifestyle psychiatry. All of the 17 global goals are a part of lifestyle medicine because, yes, if you have a health problem, you need to go see a doctor about it. But what the doctor is going to tell you more often than not is, in addition to any prescription you might have, there's some other lifestyle adjustments that are going to need to be made, right? So maybe you need to walk a little more. We all need to consume more water. Maybe we need to get a little more sleep. You know, some of these things, diet, are a part of those issues when it can factor in to mitigating social determinants. So one of the things we're going to be leaning into in the foundation is supporting Dr. Vis in his lifestyle medicine approach. And so that's why we need the United Nations to not retreat from the 17 goals. However long it takes to do them, I can tell you that our new strategic plan was framed around making sure we're touching parts of those 17 goals every day. And when we work with community partners like CCNA or IdeaGen, and sometimes people come to us and say, we don't know how to get refocused or realigned or reprioritized in light of where we are today. And we tell them, rather than try to make it up from scratch, go pick one of those boxes on the 17 goals and then add 17. So pick whichever one you want. Environment, pick good health, pick education, inequality, but pick collaboration, partnership, which is goal 17, knowing that no one person, no one government, no one organization can solve the grand challenges of humanity by themselves.
My biggest frustration is more of a challenge in our community is just lack of communication. The word, just because we hit send doesn't mean that receive. And it's just tough in our city. So we work hard to make sure that each family gets the information that they need. And then secondly, for me personally, as a military guy, just the next generation of leaders. Where do they come from? Where are these young guys who are getting their degree in sustainability and these young kids here? How did they get into the fight? How did they become equipped? So we have things like our foundation, our family foundation. I'm thankful for Rawle's support, where we take young kids and have them get into school. And I'll be coming to you for the There's all these opportunities when you have folk like us together. I'm looking at my good friend from Greece. You could ask the average kid, where's Cyprus? Put it out on a map, and you'll get this look like, I'm not sure where that is. So the world is expansive. And I want to make sure that our young people can navigate the world, that they understand that, hey, man, I'm in Greece now, I'm in Turkey. I know the politics, but I'm comfortable and I can be conversant in what I'm doing. So every time we meet somebody through you, my goal is to put my arms around them and say, come on down, and go from there. I'll give you one success story and I'll shut up. One of the things that we looked at way back when, we had a program called the GBI, where we had an opportunity to help a few families. And Kate and I worked together, and now that program, Kate, you want to throw that in real quick?
Sure, it is our guaranteed income pilot. We were able to use ARPA funds, so 170 families getting $500 a month for 24 months. And we are doing research, again, does $500 a month help a family? Do we already know that? Yes, but what are the things that really help that we don't really talk about? Where being able to have time with family because you didn't have to have a second job, or being able to go to school for visits with the teachers, these other things. And so that's been a remarkable opportunity for us, where we also want to learn from that to say, are there ways we can change our public system to be more reflective of that that respects and believes that families know what's important to them and what they need to spend their money on. So how do we also reflect back to say, how do we change ourselves and to make this a more effective way of supporting families, economic independence?
And so what's also happening is something that everyone's talking about, which is AI. And we won't get into in depth about AI, but it goes back to a lot of the conversations around what is going to happen. And it's moving so fast that I don't know that any one of us even understands how fast it's moving. Just the other day, there's new updates to ChatGPT, the Conversant. I mean, there will be more than likely a radical shift in the types and availability of jobs. And people need to be ready for that. If you went to school for coding, guess what? You don't need to, that's over. This coding is done with, natural language now. So all of the things that your organizations will be working with. I'd like to ask a lightning question as we wrap up, and that is, what is an example? We've talked a lot about examples, and you're an example of a successful partnership right here. But what is another example of a successful partnership that you'd like to share? Let's start with Rawle.
I believe one of our most successful macro partnerships is the work we're doing with Kenneth Cole and the Mental Health Coalition. It brought together 30 organizations, now almost 40, who are all in different lanes of the mental and behavioral health landscape. But what that has allowed us to do is to better communicate. It has allowed us to better collaborate, but it also has allowed us to do better sharing outside of silos, because staying in the silos is what got us into this problem. Being able to get out is what helps us. And so what that turned into, our relationship like we enjoy with CCNA. And we wouldn't have even been looking to deepen our presence in Alexandria, but for a resolution at the Mental Health Coalition that everybody needed to make sure, as much as we do nationally or globally, we had a real home game local touch. And there's nothing greater than home field advantage. And that's what Kate and Jim have been able to do for us with the CCNA partnership.
So it's breakfast.
Gotta have breakfast. Crab cakes for lunch.
I want to just acknowledge Jim in that he is somebody who at all times is thinking, how do I connect people no matter what? And it might even be a stretch, but he will say, you should know him, or you all should be working together. And he puts his own, both positive pressure and his own time and resources to make it happen, and really visualizing why we should be working together. And then he promotes it. So he has routine town halls where he's putting people before the community saying, tell us what you're doing. And he asks us all hard questions, but he really is about the business of saying, we have to work together. And then we have to acknowledge positively when people are working together and promote that. So I want to acknowledge him in that regard. Just a brief, we have so many great partnerships I'm proud of, but one in particular was, again, driven by COVID, where we worked with our community foundation and our small nonprofits and faith community to assist with community navigation and distributing emergency support funding. And so we asked those who were already grounded in the community, trusted by in the community, to say, will you take this on for us, helping individuals to access as many benefits as they're eligible for, as well as giving emergency funding to. And those groups have been remarkable, and the impact has been huge. And again, we build into it an evaluation for people to come back to say to us, how could we have done better? What should we do differently as we go forward? And how is the community driving our efforts and our decision-making versus our imposing how we want to do things on them?
Incredible. Garvey?
Quickly, one, I'd have to acknowledge our relationship with Howard University and with Rawle, where we're working with the School of Department of Psychology. We have grad students working with first responders, getting their time on station with them. And that's Chef Casey and Chief Hayes and the city. But probably moreover, a success story for me personally is to be able to pick up the phone and say to Kate, look, Rawle's in town. Can you meet us at Panera Bread and bring your credit card with you? So we can be able to get people in the room. That's kind of where we measure our success. And So far, so good, and that included now you, George, so bring the credit card.
Okay, well, final statement. What do you want the world to know, Rawle, about the work you're doing?
Mental health care works. Mentalhealthcareworks.org. If we prioritize our mental health the way we prioritize our physical health, we will live and lead whole and well.
Just the working together actually works, and really believing in each other and trusting each other.
Ditto. Nothing profound to say, except I think this was a good session. Appreciate you.
Thank you so very much.
Thank you.
Thank you.
Appreciate it.